everyone, welcome back. I'm Dr. Perkins, your board certified OBGYN, and today we'll be talking about how long can you have chlamydia before it causes damage. This is important because chlamydia can cause damage in your entire reproductive system. So we'll talk about what is chlamydia, how it spreads, how long treatment takes, and how long it takes to damage your body. Chlamydia is a sexually transmitted infection. It is transmitted by contact of any kind with a partner who is infected as well. This could be vaginally, this could be anal or oral contact of any type. Chlamydia is one of the most common sexually transmitted infections. In fact, worldwide, this infection is so prominent that over 50 million infections are noted per year. In the United States alone, about 3 million per year. This infection is caused by a bacteria called Chlamydia trachomatis. Chlamydia can live on surfaces as well and can be passed on to a newborn during the birthing process. Now let's talk a little bit more about chlamydia itself. It takes about 5 to 14 days to incubate. That means that after exposure to the bacteria, it might take that many days for it to manifest in your body and start to present with symptoms. Now, do note that chlamydia might not actually present symptoms, but if it does, it occurs during that time frame. If symptoms do appear, you may notice them up to several weeks after you actually had contact with an infected partner. A female may notice a huge change in her discharge. That discharge can be that it's more watery or the color may change. Commonly, discharge becomes more yellow and green in color. You may also notice that you have a lot of burning with urination. As the pee is coming through, what happens is that when there's inflammation that's caused by this bacteria, urine passing through can cause burning and inflammation in the area. Now you may be wondering, if the infection is in the vaginal area, why would I feel burning coming from the urinary system? Well, in our pelvis, everything is really kind of close to each other. Let's take a quick look on what that looks like. Here is an example of your pelvis. And what I want you to focus on here is that it looks like there's a lot going on. I know, there is. But there are 3 main systems here. In the back, you have your colon or your gastrointestinal system. Right here in the middle, this is our female parts. This is your uterus, fallopian tubes, and ovaries. Now, right next to that, almost like a twin to your uterus, is the bladder. So anything that happens in the pelvic area may cause symptoms in the surrounding bladder or colon as well. Males may have a very similar presentation as well, wherein they may notice a little bit of discharge that might be coming from the penis or the tip of the penis, or they may have burning upon urinating. You may also get chlamydia in your rectum. If you're having anal intercourse of any type, especially unprotected, wherever there's contact, that bacteria can transform as well. What does that look like? Well, when you're trying to have a bowel movement, if you have anal chlamydia, you may have pain, you may notice discharge that's similar to the discharge that can happen from the tip of the penis or from the vagina, because bacteria, chlamydia, is also growing in that area. So your feces may come out completely coated with or showing signs of having an infection and discharge as well. If you're enjoying our conversation today talking about chlamydia and its effects on your system, go ahead and subscribe and like. Now, let's talk more about what chlamydia does to your reproductive organs. If you have chlamydia or had chlamydia, at the very first time that this bacteria is introduced to your system, damage is already occurring. The longer it stays there is the more that this infection can start to ascend or grow or move into your pelvis, causing more damage. Let's take a look at what that might look like. Here is another image of your pelvic structures. The vagina, the uterus, we have 2 fallopian tubes, and 2 ovaries as well. Now what happens here is that when you have vaginally transmitted chlamydia, this is the vaginal space. That infection is primarily here. The longer that bacteria, the chlamydia, stays in that vaginal space, it may start to move upwards into your cervical area, into your uterus altogether, infecting that as well. And that infection can continue to pass on to your fallopian tubes and your ovaries as well. Now, needless to say, we want treatment right away because more time equals more damage. If that infection persists, then we can get a greater infection called pelvic inflammatory disease, or what we'll refer to as PID in short. PID can occur in about a couple of weeks after the initial infection. About 4 to 5% of people with a chlamydia infection may actually get PID in the long run. Now, some people can get this infection later on as well. Some people will notice right away. Now, what are the symptoms of PID? Well, you may have pain in the vaginal area, pain in your lower abdomen. You may notice discharge, as we mentioned. You may have pain with sexual intercourse. Some people may not have symptoms at all. Some studies also show that PID may present even up to a year after the initial infection. Some of the damage that chlamydia can cause in your pelvis may include scarring of your uterus, scarring of your fallopian tubes, scarring in the surrounding area of your pelvis, meaning in between all the organs that are there. This may present later on in life as infertility for a lot of people. In fact, most people do not know that they even had the infection until when they're trying for pregnancy, trying to conceive, and they're not able to do so. If your fallopian tubes are scarred or damaged from a chlamydia infection, the scarring can prevent egg and sperm from ever meeting together. Eggs come from your ovary. They travel through your fallopian tube and need to meet sperm in that same exact area. The problem here is that your fallopian tubes are very thin, very small, and it's a very narrow space. Any scarring or damage to your fallopian tube can completely prevent sperm from getting through because it's such a small area. We want to get treatment right away. That way, you can protect your entire reproductive system and protect from infertility in the future. Before we close this episode, I want to share with you a few tips for what to do to prevent causing damage in your body. Well, first thing is to get treatment right away. The second is to complete that treatment course 100%. Even if you're feeling better, if you had symptoms, it's very important that the bacteria is completely eradicated in your system. So completing your antibiotics is like top notch, very important, the best thing you can do for yourselves. The next thing is to never share your antibiotics. If your partner is also infected, they should see their provider and get their own prescription. On that note, you should also refrain from any sexual activity while you're being treated. That means complete your treatment course for 7 days. Your partner completes their treatment course for 7 days. At the end of that course, then you all can now have sexual relations again as if nothing ever happened. I hope you enjoyed our episode today, learning about chlamydia and how to protect yourself from further damage from it. Now, click the link below to get access to my free ebook talking about the hormones of the pelvic system, the hormones of your body that may influence how your body functions. Click the link below. Thanks for being here with me today.